Hello and welcome to another edition of Mosaic, an African American perspective. I'm your host, Deborah Milo. Montgomery County's African American Health Program addresses health disparities that are disproportionately affecting both African Americans and African immigrants. Well, on today's show, we'll be talking to Arlie Wallace with the African American Health Program in Montgomery County's Department of Health and Human Services, and George McFarland, founder and president of McFarland and Associates, who is responsible for implementing the program. Arlie and George, welcome. Thank you for coming onto Mosaic today.
Thank you for having us.
Very welcome. I want to really delve into the subject matter about the African American Health Program itself. So Arlie, if you don't mind, I'd like to begin with you. What exactly is the African American Health Program? Because I don't think a lot of people know about it.
Yeah. The African American Health Program, first of all, is the only program that is within HHS that really focuses on the health that impacts blacks in the county. The African American Health Program actually got originally established when David Satcher was in town.
Met Dr. Satcher, yes.
Right, he's a wonderful gentleman. Years ago, back in the late 90s. And there was a community forum that was actually put on by HHS. And Dr. Satcher presented health disparities information that was talking about the various type of chronic diseases that was impacting blacks. During that time, HIV was one, of course, along with infant mortality, cardiovascular disease, and diabetes, as well as cancer. So some of the health department professionals took it upon themselves to meet with the leadership, and they actually set up and started to design and create the African American Health Program. But during that time, it was actually called the African American Health Initiative. And then in later years, the name was changed to program. But that was dealing with some nurses, along with others within HHS who came together, and they actually crafted out things that they should attempt to do to address the issue that was impacting blacks. Once that was actually put in place, the county then awarded general funding to try to craft a program specifically aimed to address the issues impacting the black community in Montgomery County. That program has since then grown, and it's been in existence since like 1998. That's when it actually really came to be. So we're still actively involved and engaged here in the county, where we have the services that are targeted and particularly tailored to address the needs in the black community.
So now, George, how do you come into play for this?
Well, I'm the current contractor for the program. The program is contracted by the Department of Health and Human Services. And what we do is actually run the program. We hire the staff, we deploy the staff, we do the planning and the execution of the program. I've been in public health for many, many years, and like you, got my start in public health in the early 70s, and really began to appreciate particularly the power of data to drive program execution and to put in place measurements and ways of tracking our progress. So I think that one of the things that really intrigues me about this challenge of improving health status is using measurements and using data to guide our strategy and our approach to reducing the nature and magnitude of the problem.
Do you work with other grassroots programs? I'm just curious, in order to create everything that you do.
Well, the program itself is created by working with community partners. We have what is called the African American Executive Coalition. That is a group from all walks of life. They come in and work from different perspectives on health care and healthcare disparities. So we work with that group as one of the advisors, but we're also actually involved with groups such as the FEMA, who deals with the infant minority mortality review team, as well as others in the communities engaging with hospitals as well. And then we've even linked further where we have a lot more engagement with our community partners, such as our community centers, our schools. We've been engaged with the correctional facility and bringing various type of services to those individuals who will soon be released back into the community.
And that's a critical part. That's a critical part. So now, what are some of the other services that are offered by the program?
One of the programs that we're particularly excited about is our are our health screenings programs.
Oh, cool, yes.
We think it's important for every individual to understand what your personal health risks are. So we place particular emphasis on risk assessment. We want everybody to be able to take charge of your health. It's not just your physician, it's what you can do, and that's one of the things that I find most exciting. We want to put you in the driver's seat when it comes to your health. That everyone should know their numbers. You should know what your blood pressure is. You should know
That's right.
your body mass index. You should know all of these factors like your level of cholesterol, what it is, whether or not you are close to obese, underweight, overweight. So by putting you in control, you'll be better prepared then to influence the future of your health. And because health is the most important thing that you have in your life.
It really is. It really is. And that's so important, George, what you said, putting yourself in control, because when you can make those decisions, you have a better outcome.
Exactly. It's really truly all about prevention. And one of the
Yes.
other programs that George had mentioned was also focused on maternal and child health.
Oh, yes.
Because the county, we have a high rate, and compared to any other race or ethnicity, with the loss of infant death before age 1. So we actually have a program that focuses on expected moms, less than 28 weeks, that we will work with that mom along with the entire family, and make sure that we follow the child up until age 1. And we will provide information such as childbirthing class, child safety, dealing with health and nutrition, prenatal care. It's what we call basically our nurse management, coordinated care services.
Right.
And then we will also work with mom with following through with like the developmental milestones of the child to make sure he or she is really on target and developing quite well throughout that first year of birth, because that is the time that we tend to lose a tragic amount of
That's true.
infants are lost. And that's one of our other programs I wanted to at least share with you.
Oh, no, I'm glad
Yeah.
you did. Arlie, who's actually responsible for implementing the services?
Well, as Mr. George has said, his office and his program is responsible for it.
So you do the full
Yes.
implementation?
Yes, we do the full implementation. We are unique in that we have nurses who actually go into the homes. Increasingly, we're looking at not only clinical services, but we are looking at some of the social determinants. In other words, we understand that the environment is also very important. We understand that stress, we understand the whole safety of the house is important, the sleeping arrangements.
Right.
So unlike when you go to a doctor's office where they aren't able to look at the sleeping conditions, the arrangements, the family, the safety and security where children are, we are given then a unique opportunity and an opportunity to bond one-on-one with that mother. We're trying to increasingly involve fathers in the decision-making of ensuring the safety and security.
Especially with young parents.
Especially with young parents, and really understanding things like the importance of having safe sleeping arrangements, avoiding co-sleeping.
Yes.
And the other important thing, I think it's really important that we stay with the child and the mother and the family for 12 months after the child is born. So we know that it's not only important that we have a healthy live birth, that it is a full weight, a healthy weight, but also that we have available the technical resources and the knowledge and skills needed to ensure the continuity of that and developmental growth of that child. So we're able to weigh the child, give the mother advice on medications, keeping appointments, providing social support, emotional support, looking at issues like depression. We know depression is a big issue.
Oh, absolutely.
You know, and so really just understanding the emotional challenges inherent in being a new mother. The first 12 months, particularly, very often you have children who cry a lot, and sometimes new parents aren't prepared for that.
I got news for you. Old parents are prepared.
And not only that, because we live in a community where you have this whole intergenerational of individuals in the household from different ranges, we're now also making sure we're engaging the parents and making sure that we be as tactful as possible in making sure that how grandmother or auntie may have raised the children,
That's right.
that we now have to instill and pass that knowledge along to those caretakers. So in the absence of mom and dad, that we want to make sure that grandmother or auntie, whomever, is laying that baby safely on their back with nothing in the crib, nothing in the crib, and try to emphasize those as well. And I do want to say is that our program, there is no cost whatsoever for anyone who gets involved with our program.
That was my next question.
Okay.
Say that again.
There is no cost, there's no eligibility requirement for anyone to be a part of our program whatsoever.
And see, that's so
Right.
critical.
And coming from the health department,
Yes.
that shows you the uniqueness of this program
It
and
does.
the emphasis of why the county had to take it on, knowing that there comes a time that you cannot look at the income because the factors that involve, say, low birth weight babies or infant mortality death has nothing to do with one's socioeconomic
That's
status.
right. That's
So
right.
we want to make sure that we open it up for everyone.
When it comes to African Americans in Montgomery County or Africans in Montgomery County, how do those rates compare with other counties that you've seen so far?
Well, it really kind of depends on the area you're looking at.
Okay.
Montgomery County, despite the fact that it's wealth and it's education,
Right.
when you start to look at, and I'll say the three largest, including Baltimore City, Montgomery County tends to have some of the highest, it's the third, if I'm not mistaken, with infant mortality loss among blacks.
You and I talked about that before.
Yes,
Yes.
and it is still, that trend has not changed. There may be times that it may have a drop, but then eventually something happens, and we think that could be related to the true diverse population of blacks that Montgomery has, and the age in which individuals also having their children also could have some implications, as well as George said, the environmental issues. You know,
True.
the strains that it put on families with the stressfulness of the cost to live in Montgomery County. You know, having to choose different type of thing in order just to live here. So that is one. We also tend to have just a much higher rate when it comes to diabetes. Although
That's another one, yes.
blacks may not have the highest diabetes rate itself, it then has the highest when it comes to early disability, amputation, as well as frequent visiting to the ER room for issues related to diabetes. So we have a lot of other facets that really impacts one who suffers from those type of chronic diseases, and it's really across the board. Now, one can say because we are so diverse, we have a substantial number of blacks that lives in the county,
Right.
which would also impact your numbers on a greater degree. But when you start looking at the prevalence and the causes, and more so the mortality, and these things are something that we can really address through prevention. So we do see that Montgomery County, despite its location, those numbers are still just as high as it is in other areas where you would expect for it not to be in comparative.
Okay. When we come back, we're going to talk more about that because I want to touch on some more things, and we're going to talk about the upcoming event as well.
Thank you.
Thank you.
For those of you who've just tuned in, you're watching Mosaic, an African American Perspective. I'm Deborah Milo, and we're talking with Arlie Wallace with the county's African American Health Program, and George McFarland, founder and president of McFarland and Associates. After a quick break, we'll be right back with more conversation about this very important health initiative.
I'm a retired school psychologist, and helping people was my thing. After my stroke, when Meals on Wheels started, I was on the other end of the stick, so to speak. And I appreciated it very much, the attention that was given. My name is Julius Gaines, creative writer, poet, photographer. America, let's do lunch.
Drop off a hot meal and say hello. Volunteer by donating your lunch break at americaletsdolunch.org.
You've messed up your son's haircut.
Mom?
Do you A, try to fix it,
Like it never happened.
B, work with what you got, or C, show solidarity?
Thank you, baby.
As a parent, there are no perfect answers. But you don't have to be perfect to be a perfect parent. Thousands of teens in foster care will love you just the same.
Please have a seat. I'll be honest. Your resume, no one amused you.
I know.
Okay, so what would you bring to my company?
What do you need?
I need a hard worker.
Good. I've got 2 part-time jobs and to help my parents pay the bills.
I need problem-solving skills.
I got through high school without a car, a phone, or a computer.
No college degree, though.
Not yet, but life's taught me a lot, and I'm ready for more.
Well, you're not the typical kind of candidate that I hire. But you are exactly what I'm looking for.
Your company could be missing out on the candidates it needs most. Learn how to find, cultivate, and train a great pool of untapped talent at gradsoflife.org.
Welcome back to Mosaic, an African American perspective. I'm here with Arlie Wallace and George McFarland, and we're discussing the African American Health Program here in Montgomery County. Arlie and George, before we went to break, I did want to talk about the status or the state of African American males and the health disparities here in Montgomery County. Can you both touch on that? George, can I start with you this time?
Yes, first of all, I would say one of the biggest problems is that generally African American and men of African descent have the shortest lifespans.
True.
And they live, unfortunately, some of the sickest lives, meaning that very often they die from preventable illnesses.
Right.
And I think that's the good news. The good news is that these are, for the most part, things that we can really do something about. And I'm just so impressed at what happens when people become aware. You know, we think often we have to depend on miraculous machinery or medications, but really, it's about information. Information is power.
It is.
It is.
And when we
It
take
is.
that information in, and I'm just really impressed at the number of people who come up to me after a seminar or a workshop and say, really, I feel like you saved my life. And I'm just so impressed. I feel that I've done so little.
They're empowered.
They feel empowered. And I think there are things like over half of black men and women in this county are overweight or obese.
Half?
More than half.
More than half.
Yes,
My
and
goodness.
that's something we can do. And many of us aren't aware that we are obese.
That is correct.
And
That's
that's
correct.
why it's so important for us to do the body mass index
Oh, yes.
screening. So people are amazed, you mean I'm obese?
Yes.
And we say yes, but we can do something about that. And we can start today. We can start tomorrow. And the more important things are just the beginning to take more care in what you eat, the portions you eat.
That's right.
As Arlie says, make sure there's more color on your plate.
Oh,
and
yes.
make sure that there's not so much on your plate.
That's right.
But particularly if we can get rid of the fats, the sugars, the starches, we can begin to get more healthier diets. We can begin to lose weight. And of course, there's nothing more powerful than exercise.
Yes.
So that's what we can do to change the trajectory of our health. And that's something that we can do ourselves. And I think that's what excites me.
Right. And not only we've been at and trying to work on men's health for some time. Although most of the time people tend to think we're just women oriented because we've had a lot of women be more engaged with our program. But we've done such things focusing on fathers' involvement with the children,
Yes.
as well as fathers taking care of themselves. This year, under the leadership of Mr. McFarland and his company, we've instituted what is called, at least starting, to jumpstart, Brothers
to
Brothers Talk.
Very nice.
The
Okay.
first time ever bringing together black males to come out and talk about issues that are impacting them so that they can openly come in a private setting with females removed. This is all males.
Oh my,
And to
okay.
be able to come together and concentrate on those issues, and then for them to come up with a strategy on how they will address those. That's going to be an initiative, I think, just based upon our own weight loss activities that we've been focusing on for the last couple of years with having a physical movement taking place. Are also bringing them together to deal with those emotional issues that are also impacting them.
Because they do.
Yes, there's a
really
lot of
do.
thing about masculinity that
Oh,
males
yes.
don't necessarily want to talk about
Right.
those, but we know that those are issues that need to be addressed, as well as making sure that we gainfully get their insight. the one thing about any given program, to try to implement something without getting their feedback, more than likely your success rate is not going to be nearly
that's
as high.
true.
But if once they have the buy-in, and I think this was a good piece that George and his team has come up with, to really bring them in to talk about, where we can turn around and hopefully create men groups that are going to be talking to each other, men walking groups,
Oh, yes.
as well as men that currently come together in a different form. And I believe, Mr. McFarland, we have a piece going at one of the local churches
Yes.
where Mr. McFarland has actually been going out and speaking about using technology.
Oh, this is great.
You know, not necessarily talk about but to say,
Right.
you know, with that, you don't have to talk openly about your issues, but just think about, let's put it on your handheld device, right,
That's
Mr.
right.
McFarland?
That's right.
Yes.
And then to have those open conversations about how important and powerful that hand tool is, and that's something in which he has been able to really talk
Very nice.
to bring the audience into agreement upon on a regular basis. And I think we are attempting, and we are going to hopefully even expand that type of activity with males.
You know, I'm interested very much in this because, you know, unfortunately within our own families, we've experienced when our men, please excuse me, our men are not comfortable going to the doctor.
That's right.
And they're reluctant to go, you know, they just, oh, do I have to do this?
Yes.
It is a mindset. And I think that that's a cultural thing for us. I really, really do, you know. Can you talk a little bit about that, George? Have you
you know,
seen
I think
that?
what an interesting thing. We just had a session with a group of men at a church in Silver Spring, I guess on February 18th. And it was very well attended, approximately 40 men, all men, just a continuation of the Bible study class. And the interesting thing was that many of these men talked about their personal experience, really came from the heart. And what we're trying to do is have sessions where there's a blend of the physician talking, the nurse talking, as well as men who've gone through the struggle.
Oh, yes.
So it's a particularly poignant discussion when men talk about what has happened to them. And sometimes men are reluctant to talk about the pain that they've gone through, about the depression that's associated with diabetes.
Yes.
And of course, diabetes is so prevalent in our
It is.
community. And you talked about the health disparities. Certainly that is one of the big issues. And then that gets us into the whole discussion about cardiovascular health.
That's correct.
And so cardiovascular, because most of us, when we leave here, it would be related to heart disease.
That's
a
unfortunate. You're right
stroke,
about that.
Heart attack.
Yes.
It will be one of these issues. And these are things we can do something about. And again, there are these cross-cutting issues. Also, when I say cross-cutting issues, I'm talking about the range of issues that affect health. So it's not just depression by itself.
That's right.
But there's often diabetes and depression associated with diabetes, but also pregnancy, postpartum pregnancy, all of these things. So, and we like to think about the importance of oral health, and
that's
men
so
very
key.
often,
Yes.
and we sometimes don't realize that oral health is important to cardiovascular health.
It is directly related.
And
Directly related.
a good friend of mine recently, who's also a dentist, talked about the importance of good dental health and how we hold our head, and whether or not we hold our head erect, and how when we don't take care of good dental health, it affects our total health. So that's what we have to really understand. And I think that I often say the most wonderful thing about this is good health is a way to save money. I know that we often don't think about that, but it is a way to save money.
That's a reality.
Yes.
That is a reality. You know what, before we conclude today's show, I want to make sure we talk about the African American, the program, the Community Day that's coming up. Arlie, can you talk about that, please?
Yes, I can. Community Day is going to be Saturday, April the 15th.
Saturday, April 15th.
It's going to be from 10 a.m. to 3 o'clock p.m.
Okay.
It's East County Community Center. That's located at 3310 Gateway Heads Manor here in Silver Spring, Maryland. We're going to offer an array of things from screenings, food demonstration. We're going to have some fitness activity.
Mm-hmm.
We're going to throw a little bit of yoga in as
very
well.
nice.
Yes, we're going to have some fitness trainers available. We're going to have some things focused for our youth as far as doing, hopefully, if the weather holds up, we're going to do some things outside with the youth for sure.
Oh,
we're going to
that would be
even
great.
talk about basic gardening with our younger
That's
group.
new this year.
Well, you know, this is actually going to be our second year that we've
Okay.
attempted. Last year we did do it as well, but this year we're going to do it again, where we're going to have folks who come in and
I
teach.
missed it last year.
Yeah, I think you were a little bit late when that piece was actually taking place, but we are going to have it. We think we're going to have some really good engagement with everyone to be able to come out and do some sampling. We're going to even have recipes that we plan to give out about some healthy, good recipes, and not necessarily meat all the time, but
Of
some
course.
plant-based type of recipe that we feel
More
will
color
be
on your plate.
More color on your plate. We love some greens, some reds, some yellows,
Yes,
and fresh.
yes.
We love that. You know, and we will indeed still include the other meats and things, but not as much. So we think it's going to be a great grand day. We're hoping that we will reach just as many as we met last year. Last year we was fortunate enough to have at least about 400.
Something like that.
maybe.
I remember that.
This
yes.
year, I'm hoping we will have close to that 500-600 to come out. And we're also going to be supported by a number of exhibitors from the county, as well as we hope Parks and Planning, the Rec Center, hospitals, and others. The local colleges is going to actually come out and
that's
support
fantastic.
us.
Great.
So I'm getting I've gotten a lot of calls from different groups now who really have an interest in coming in and coming out and joining us, and we'd love to have everyone to come out and make that be a very grand day.
Okay, and you know what? I'm glad that you said that. Is there a phone number and a website by chance?
The phone number which we can call is our main number, and that's 240-777-1833.
Okay.
And then if they'd like to visit us on the website, they can go to AAHP Montgomery County .com. I think that's
Okay.
correct.
Now, if a citizen doesn't remember all of that, can they go to the actual HHS website and get access to it?
Well, they'll be able to go into the African American Health Program website.
Right.
That's why we have to end up Googling. And even if you Google AAHP
Dot
or
org.
the .org,
.org?
it will come
Yep.
up, and we will have everything posted. We're on Facebook as well.
Yes,
and
you
all the
are.
other little things. So we're trying to move into
Twitter.
the technology era.
I saw that wink. I saw that wink. Well, it sounds like it's going to be as usual. I've been fortunate enough to attend the past couple of years and was fortunate to be Mistress of Ceremonies last year. And it was just such a phenomenal event. And George, this is part of your doing as well.
That's right.
So
We're
this is
excited
kind of
about
like the outcome of all the work that you do throughout the years, what it sounds like.
Yeah.
This is going to be wonderful.
And
Yeah.
Deborah, if I could just mention that we have really created a really great relationship with a lot of our churches who are allowing us to
Yes.
come in and do screenings and talk about the relationship between the faith of the
Yes.
church and the wellness of the body.
That's right.
And so in integrating those two into a conversation, and we've just really been able to reach a lot of people that we wouldn't have otherwise been able to reach had we not been able to bring in the churches as part of our partnerships. And you talked earlier about the importance of partnerships. We have such a tremendous resource in county partners who are able to integrate with us and take the health and wellness message in ways that we couldn't do otherwise. And we just think it's such a unique and special opportunity.
Well, this has been a fantastic show, and Arlie and George, I thank you both for coming on today. We'll have to have you back because there's so much that we still didn't get a chance to cover.
That is
Thank
so
you for
true.
having me.
Thank you.
Unfortunately, that's about all we have time for today. And I want to thank our guests, Arlie Wallace from the African American Health Program and George McFarland with McFarland and Associates. I'm Deborah Milo. Please join us again next month for another edition of Mosaic, an African American perspective. Till next time, make it a great and healthy day.